you. Welcome. Good morning. Thank you for joining us. I'm Dr. Esteva here at Silhouette Med Spa and Weight Management. And we're probably going to have to change the name to say Hormone Replacement Therapy. I'm so proud to be a member of the BioTE family. And really, I'm here to offer my clients, my friends, and my family this opportunity to learn about hormone optimization. It really is, especially as an OBGYN, also doing weight management is really, I think, the last piece to the puzzle in creating longevity, helping feel better, and really complete the program that we're here to make you a better version of yourself, and to feel young again and to feel vibrant. And so that's really what's exciting. Traditionally, as an OBGYN, it's very interesting how a lot of this information really is not shared in the traditional curriculum, meaning being taught about hormones. They really don't emphasize the importance of what bioidentical hormones and their role in optimization of your hormones. They don't really emphasize that point. And so it was through learning about it, I feel really a great pride to be able to offer this to you in a safe, effective manner. So here we go. We could save questions till the end, and obviously personalized program recommendations with a consultation with me. So hormone havoc, what are hormones? Why are they important? And what is hormonal imbalance? It's kind of like a broad term, right? And so hormonal havoc, what do you need to know? What can and should you believe? I think there's a lot of information. Even prior to my training, it was very vague, and people are just scared to be, or very intrigued by the notion. And what can you do potentially? You know, when you go to your doctor and over they tell you, you're fine, everything's fine, and you go, but my thyroid, and you go, and I don't feel myself, I feel exhausted, and then they go, you're fine, everything's in the normal range as far as the lab says, but you're not fine. So hormones really are chemical messages made by endocrine glands. Endocrine glands are going to be such as your thyroid, adrenals, were glands above your kidneys, as well as glands in your brain and your pituitary hypothalamus. And they're going to send messengers which work in a lock and key fashion. So the question really becomes, is it the chicken comes before the egg, or do we age because we lose our hormones? Or do we lose our hormones because we age? So I think it's a funny slide. So in general, have you found yourself feeling like this, irritable, not yourself, angry? Or would you like to be like this, happy, youthful, have the energy to do some of the activities that you would like? Or do you feel like this, do you feel like a lot of chronic pains coming into your hot life, fatigue, headaches, just overall generally not feeling yourself? And are you wanting to feel back to normal? So, people think of bioidentical hormones, testosterone, you instantly think of decreased sexual drive. That's the premise. But actually, a lot of the symptoms people feel are just in general well-being. Are you having some of the symptoms of low hormones, which are extreme fatigue? Like you wake up okay, but about 3 to 4 p.m. you hit a wall. Are you having mood swings all of a sudden, anxiety? Do you feel tension, irritability? Are you waking up in the middle of the night and just not getting good night's sleep anymore? Are you noticing little things that you're forgetting, and you're having memory loss, depression, lack of focus, brain fog? Hot flashes for some of the women, night sweats. Were you great all your life and all of a sudden 30 pounds came on, in your late 40s, early 50s, joint pains, bladder problems, migraines, severe headaches, and decreased sex drive and or performance. So that sexual health is very important, but I think that also recognize there's a whole lot of other things that this helps with. So what is the BioTE method? What hormones does the BioTE method balance? And as Melissa had mentioned earlier, really focusing on testosterone, estrogen, and thyroid. In order to enhance those hormones, we also offer vitamin supplements, which are called nutraceuticals, to help improve the results, right? And so it's basically going to further enhance your results. And they're really important. There's going to be some that are going to be mandatory when you're on hormone therapy to protect different organs in your body. And then there's going to be other things that you can choose to add on this new journey. So let's start with something called andropause. We've all heard of menopause. But what is andropause? So here's some facts about andropause. It's male menopause or menopause. 20% of males over 50 have low testosterone. It's very common in men with diabetes, high blood pressure, sleep apnea, and other chronic diseases. Again, this is where we don't know if it's the low hormones causing these diseases or the diseases then going back and causing low testosterone. Being low T or low testosterone is linked to early heart disease, and it's really underdiagnosed. Why? The range of normal testosterone, and depending on the lab, is somewhere around in the 200s to 1200s. So if you're hanging at 300, completely symptomatic, your doc's in conventional medicine is going to say, you're fine, you're okay, not really listening to the client or the patient. In addition, we have this TV monitor, and I think that what they're alluding to is these, the big hurt, the testosterone, selling these pre-testosterone pills over the counter, which really are not pharmaceutical grade or anything close to what you would get in feeling better with BioTE. So testosterone, here are some facts about testosterone. It provides major symptom relief, and it's protective, especially when you're doing the bioidentical form. And I'm going to go into what that means. Basically, it protects the bones, the brain, your breast, and relationships. It's present in both men and women. It's large amount in men and smaller amounts in women. As an interesting fact, men, as they age, at 30 to 70 years of age, they will lose to 1 to 3% testosterone per year. So as they're getting older, you're losing. Women, the same thing. Starting in their 20s, you'll actually lose up to 50% per year. So, probably not in your early 20s, it'll be less of a rate, but definitely, in your 30s to 40s, you can have an exponential decline in your testosterone. Positive effects of natural testosterone for men and women. So what does it do for you? It basically increases energy and vitality and a zest for life. You have an improved sense of overall well-being. Especially now with COVID and a lot of the anxiety, depression that's happening, just being indoors, it creates a lot of relief. You also have a lot of cognitive benefits, including memory, focus, obviously enhanced libido, and enhance performance. And then don't forget about the what it protects you from. And so it's breast, prostate, brain, heart, and bone protective, right? It's going to build bone, increase blood flow to your heart and brain. So this increases bone strength, increases muscle strength, and reduces body fat. It also lowers cholesterol. So reducing body fat, you become leaner. I wouldn't use it as a primary weight loss. You can't just eat whatever you want, but it does fit well with our other weight management programs. And this will definitely help you maintain that weight off. So here's menopause. And here's some facts about menopause. 3,500 women enter menopause daily. Symptoms can begin up to 15 years earlier. So if 51, 52 is the average age of menopause, in your early to mid 40s, you can already start to feel the symptoms. Most women are affected in more ways than they realize, and that's because there's a lot of neurologic symptoms that people, even their OBs, don't acknowledge, like tingling, numbness, palpitations, the brain fog, along with the traditional hot flashes, decreased libido, and fatigue, weight gain. Most women do not ever get over it, or get through menopause completely, meaning they can have these same symptoms well after they've gone through and stopped having periods. So menopause is very important in the sense that it's a time when you lose because you lose your natural hormones, you become more susceptible to heart disease. And as they start to fail in the premenopausal women, 1 in 7 clients will actually die from heart disease. And for postmenopausal women, that number rises to 1 in 3. So many women are fixated on the fact, oh, I don't want to get breast cancer. I don't want to get breast cancer. Breast cancer is not the #1 killer of women. It's actually lower on the list. It's because heart disease ends up being the highest killer of women, and that is correlated with a decrease in your hormones. So estrogen, much like testosterone, estrogen is in both men and women. Obviously, larger amounts in women and a very small in men. Has over 400 functions in the body. It controls hot flashes, maintains bone density, helps maintain memory, collagen in your skin. What does collagen do? It fills in the fine lines and wrinkles and keeps a youthful appearance. And it increases serotonin and dopamine. Those are the happy hormones. That's what kind of makes you feel good. And that's what SSRIs do as well. They increase serotonin and dopamine. This does it naturally. So what are some of the positive effects like we've already kind of gone through? Hot flashes, increase collagen, which helps with skin integrity, increase overall feeling of well-being with your serotonin, your dopamine, maintains bone density, increases bone strength, helps maintain memory, prevent neurodegenerative conditions, so and lowers your cholesterol, it lowers your bad cholesterol, but also increases your good cholesterol, which is HDL. It also protects bones, breast, brain, and heart. So what are we getting to here? Hormone therapy, hormone replacement methods. So this is where we kind of get into the meat of what bioidenticals are. In my training, really, they did focus a lot on synthetic hormones because these are the hormones that were studied at the time because they were big pharma. They were studies that were produced so that people could make money, really making hormones that don't look anything like what we have in our body. They came in the forms of pills, patches, and shots. So this is where you get, something made in the lab, or you get something that is not yours, like horse urine. And so that was really eye-opening. Bioidenticals are hormones that your body have already seen. They're the testosterone molecule that is the testosterone that your body saw at, your whole life. There is no extra side group that was added to these, such as in synthetics. And those side groups are the ones that cause really a lot of the side effects. So bioidentical hormones, testosterone, estrogen, as well as the thyroid, come in the form of pills, patches, creams, gels, and pellets. So conventional hormone replacement methods, the Women's Health Initiative in 2002 was a flawed study. So in case you were just like, but I thought hormones were bad, like didn't everyone get taken off their hormones? So what happened is it was a very flawed study. It was a study using synthetic hormones, not bioidentical hormones, which increased stroke, heart attacks, breast cancer, twice the rate of blood clots, and 76% the rate of in Alzheimer's disease. Many women who were taken off of that were not given an alternative of natural bioidentical hormones. And so as a result of that, actually many more women ended up dying, not from breast cancer, which they were supposedly saved from, but actually had more deaths from MIs over time. The author of the initial Women's Health Initiative actually 15 years later redacted the study and said it was completely flawed. It did not show what the intention was, and she felt really bad that it was unintentionally created a lot of heart disease in women who were pulled off their hormones. So not only do you need the right hormone, we're going to go through why you need the right route of dosing, whether it be a cream, a patch, oral, or a pellet. And so these are the differences. Estradiol levels in patches are better than pills, and so, but not as good as pellets. It created some problems in the use in that some people had allergy to the actual sticker that you had to place. They had adhesive problems. You also needed to change the patch throughout the week. You had some weight gain, but less fluid retention than being on the synthetic or horse estrogen. So, and then 45% of people did not absorb the skin. And so what they're alluding to here is the Climera patch. And that actually does have a bioidentical hormone in it. But so they picked the right hormone, but the application it might not be ideal for all people because of the lack of absorption and the allergy issues. So the next thing you could think of, okay, you know, instead of a patch, I really want to do a cream or a gel, but it becomes tricky as you're trying to quantify these gels, also getting the concentration correct. Did you apply enough? Did you rub it in? Are you going to do it twice a day? It becomes cumbersome. The reason you have to do it multiple times a day is because that's a short half-life, and is it even absorbing? Can it be transferred to others like babies and pets? Most importantly, if you use a different type of estrogen in these, which is called estriol, it does not protect bones, heart, and brain. And it's proven in studies. And the reason is because this is, yes, it's an estrogen, but it only has 10%, 10 to 15% reactivity with the receptor, meaning it's only 10 to 15% effective as an estrogen. It's a weak estrogen. Okay, so now we can say, okay, we've done patches, pills, creams. Now let's talk about injectable testosterone. With injectable, it's uneven absorption because you get really high peaks, really big kind of drops. There's a significant roller coaster effect, 99% synthetic hormone, and that's testosterone with these huge groups attached to it, which cause a lot of the adverse effects: liver toxicity, heart disease, elevated cholesterols, and then it decreases your good cholesterol. There are way more risk and benefits with the synthetic testosterone. So, and it always seems to wear off before your next dose. There's different regimens you could do, but in the end, you're still having a fluctuation in that. And when you're having too high or too low, that's when people feel themselves getting really irritable and cranky. So now we're going to talk about pellets and the importance of it. So bioidentical pellets, they're basically natural plant-derived compounds, meaning we're producing these hormones that look the same as yours, but through plant sources, not animal sources. They have the same molecular structure as human hormones, but they last longer than under other treatments. You're not injecting this huge needle or putting creams daily. They are between 4 and 6 months. So you're coming a couple times a year to address your hormone issues versus this daily kind of treatment, or weekly with other modes. The most widely studied form of bioidentical hormone replacement therapy, it provides a steady stream of hormones in your body. And because of the BioTE method, they take your health history, your current hormone levels, and they calculate it through a dosing algorithmic site, meaning they are able to kind of recommend individualized dosing based on your levels. These small rice-sized pellets are placed underneath the skin with some local lidocaine, generally pretty well tolerated. You don't even feel it's there. So what are the history of pellets? This is not a novel idea. They've been around since 1939. They were initially used for women who had radical hysterectomies for hormone replacement. And there's multiple studies with them, over 80 plus in the US and other countries around the world. So this is kind of what I was alluding to when you compare now we know that we would rather have a bioidentical form versus something synthetic that's not made from a body or from a horse. So we know we want to do bioidenticals. Now, this is the difference in what we're seeing and why we're fussing about the route of delivery, or the route. So if you can see this, if you look at the purple line, that's what you're going to see if you're taking an oral estradiol. So you got the right hormone, but on a daily basis, you're going to peak and you're going to come down. And so your levels are going to fluctuate on daily, and that's representing the purple line. If you do a patch, a patch is good every few days. You put it on, you're going to peak. And yes, it is less of a drop, but you're still having drops. Now, once you put your implant in, within a week, you're pretty much at this green line, this steady state. That means the average amount of hormone that's given over that 4 to 6 months is pretty steady. And that's what we want. So what is the BioTE method of pellet therapy? It helps the body return to a normal hormonal balance and physiologic state, but not to what you are right now. It's going to optimize you to what you felt like when you were 25. It's based on the right kind of hormone, being bioidentical, the right amounts, really individualizing the dosing. And I'm not looking for numbers. The numbers are going to help me guide, but I'm listening to you and I'm modifying how much hormone you get based on your symptoms. Are you at after your first dose, at 8 out of 10, you're great, or were you a 4 to 6? Well, we need to increase that. I'm going to take the levels into consideration, but I'm going to listen more to you in adjusting your dosing. In addition, we provide the pellets, which are the right delivery system. So what is the BioTE method of pellet therapy? It's safe and evidence-based. There's hundreds of studies, 75 years of experience, and used in 5 continents. It's clinically effective, where you're getting a consistent dose. I think it's just really convenient. You're implanted a few times a year. It has a low side effect profile, which we'll go through later. And it really is the best method to increase bone density, and even better than estrogen alone. No evidence of increased breast cancer risk. It does not stimulate the breast tissue. But what really did in the Women's Health Initiative was the progestins, the synthetic form of progestins. There's no increase in blood clots, heart attack, or stroke, and study shows that hormone optimization may be protective to all the things that we have kind of mentioned, including your relationships. So let's talk about some of the side effects and what people I think are most concerned about when they hear about hormones, and when you tell your girlfriend or your mom and they go, oh no, you're going to get breast cancer. And these are some of the studies that we can kind of review. So there are hundreds of studies that take home this point. Testosterone delivered by pellets does not increase the risk of breast cancer, unlike oral or synthetic methyl testosterone. Testosterone implants have shown less stimulation of breast tissue. Treatment with testosterone and estradiol, which is the natural form of estrogen, implants does not increase the risk of breast cancer, even in breast cancer survivors. Estrogen alone does not increase the risk of breast cancer. Again, it's the progestins. Breast cancer studies. So here's an example of a study, hormone replacement. This was in 2001, so we're looking at recent studies, relatively recent studies. Hormone replacement after a diagnosis of breast cancer, relation to recurrence and morbidity. So they took people who already had a history of breast cancer, and they saw the benefits of, like, we need to have some bone health prevention, some Alzheimer prevention. They took 2,755 women aged 35 to 74 who had breast cancer, and they treated them with pellets. They had a recurrence of breast cancer in people with hormone replacement at 17 per 1,000. So if you had breast cancer before, you recurred 17 out of 1,000. But if you were not on any hormones, you had no hormones, your risk of recurrence was twice that. So in the group with no hormone treatment, they actually had 30 who had a recurrence out of 1,000. Breast cancer mortality. So if you looked at the mortalities, okay, say you had a recurrence, and who died once they had the recurrence? 5 per 1,000 people using HRT died, versus 3 times the amount, 15 per 1,000 people in the non-users. The total mortality were 16 per 1,000 years in hormone replacement versus 30 per 1,000 person years in non-users. So really, breast cancer is a multi-factorial disease. It could be genetic, it could be environmental factors. So we're not saying that nobody on HRT ever gets breast cancer, but we're saying it's not a cause of effect. Typically, it's multifactorial. And if anything, what this shows is that it's actually protecting and lessening the severity of disease being on these protective hormones. Now we can talk about bone health. Osteoporosis. We've all heard of osteoporosis. That's the thinning of your bones. Testosterone actually could be considered the bone builder. It's demonstrated that 4-fold increases in bone density over oral estrogen, which is really what we're taught of as the gold standard for increasing and preventing, for increasing bone mass and preventing osteoporosis. If you were to look at just oral estrogen here, so there's an estradiol oral tablet. It increases your bone density by 1 to 2% per year. If you increase that and you replace it, it's the same estradiol, but you put patches because absorption's better, it'd be 3.5%. But if you did pellet therapy, it goes to 8.3% per year, which is really significant, especially in postmenopausal women. Arthritis, as I've been getting older, I'm in my 40s, I definitely just feel different joint and body aches. 10% of men and 18% of women over 60 have osteoarthritis. That is where you're having pain and aches in the junctions between your bones and your muscles. It really is the fourth leading cause of disability as people become, really physically impaired. Both estrogen and testosterone can stimulate the precartilage cells, possibly reversing development of arthritic tissue. So it really allows you to decrease it's anti-inflammatory, essentially, really helps you feel better so that you're able to actually do the workouts and have the energy to do what you want to do. Brain health, this is literally a no-brainer. So Alzheimer's disease, women get it 8-1 over men. Women on estrogen are 50% less likely to develop Alzheimer's disease, and men with low testosterone are 3 times more likely to develop Alzheimer's disease. And so we're thinking anti-inflammatory as well as increase of blood flow to the brain as the mechanism of action. Heart health, women hormones, and the heart. So estrogen replacement with pellets has positive effects on fat in the postmenopausal women, which improves your lipid parameters. So again, you're going to become leaner. You're going to have decreases in your bad cholesterol, increases in your good one, and decreases in your free floating, what are called triglycerides, which is basically stored fat. Addition of testosterone does not negate the favorable effects of estrogen. So some people think, if you add this testosterone, typically you get bad cholesterol levels, not with bioidentical testosterone. So it actually it acts in conjunction to improve your cholesterol markers. Marked fat reduction was seen with estrogen plus testosterone when they did a study after 2 years, when they were on both estrogen and testosterone. So it does really help with your metabolism. And many studies show beneficial effects of natural testosterone in the heart. Again, anti-inflammation, increased blood flows to the heart, which is what you want. Men, so that was women. So men hormones in the heart. So testosterone plants also have a favorable cholesterol profile. The metabolic facts are they mark reduction of fat and improve lean body mass. Many studies show benefits of natural testosterone in the heart. So addressing the risk of pellets. What are the risks? Okay, because everything has risks. You get in your car. I tell people you drive every day. We always have a risk of something. Especially after the first month, you can have some fluid retention. You might feel some swelling. You might not even see the scale move at all. It might go up because of this fluid retention. We'll address that with a water pill that you would do for the first couple of months to prevent that. Swelling of the hands and feet, especially if you're in a more hot, humid climate. Less than 2% of patients experience any side effects. So even though these are the potential side effects, they're relatively low in the rate they would affect you. Other side effects are breast tenderness and nipple sensitivity. Definitely approximately 2% of people can have uterine spotting or bleeding. And that is a real concern that we would have to work up. You just can't say, oh, that's normal. But that's why you see an OB-GYN like myself to make sure that we get you the appropriate services that you needed if that were to happen. Mood swings and irritability, pellet extrusion, what does that mean? We implant this under the skin. We have you do some, you're physically, we ask you to be and not so active for a week, and that's to prevent them from coming back out through the incision, which was pretty rare. You can start to get a little acne. You can have reduction in testicular size, and you can have reduction in sperm count. That's why the supplements are important and mandatory in order to prevent some of these side effects. So here's some of the key facts. Hormone imbalance can occur in men and women at any age. Not all therapies are equal. Hormone balance is not a one-size-fits-all approach. We are currently offering this at School of Med Spa to enhance your overall sense of well-being. And low normal labs may not be optimal. You know, if you don't feel right, then you're not right. Your hormones, your vitamin D3, which are the supplements, thyroid, testosterone and B12 are all things that we can actually use to help you feeling at your best. So one of the first steps that you could do is, if you already know you're sold, you make an appointment, you get labs drawn either here, we send you to LabCorp, whichever you feel comfortable in this post-COVID era. And then you come have a consult for me. If everything sounds like it's going to work out, then we can pellet you that same day. Thank you.
Nice. Thank you, Dr. Esteva. That was awesome. I do want to share our special with you guys. So when you call to book your labs, if you mention this webinar, you will get $50 off of your procedure. And if you're a new client to Silhouette Med Spa, you will get an additional 50% off. So that's exciting. So as Dr. Esteva said, the next step would be for you to call in, and she can talk to you about getting your labs and doing your consultation. And we'll move into questions.
Just to clarify, it would be $50 off for new people starting BioTE, and then it would be another $50 off if you're a new client here as our new client welcome.
Thank you. So we're going to go ahead and dive into some questions that were asked. I do feel that you answered a lot of these along the way, but let's go ahead and just bring them up. So one person asked, does this treatment increase chance of breast cancer, and what are the studies? And I do feel that you answered that well, and you did mention a lot of the studies that are based around that, but I don't know if you wanted to just kind of revisit quickly on that one.
Yeah, absolutely. So it really does it seem to be health and breast protective. I think it's important to be sure that you have and are able to read those studies. So that's something that we could definitely provide you on an individual basis so that you're just well informed of that risk. And as you can see, they even did in some of the studies, people had already had breast cancer.
Perfect. Yes, we absolutely do have a lot of studies around this topic. So if you call the office, they can definitely send some studies over to you, email them to you. Next question, how long do you use this treatment? While going through menopause, or keep using long after? And how do you gauge when to stop?
Okay, so that's a really good question. I think that the whole point is that we optimize you to a level where you feel good, but you're right, it is definitely a lifestyle modification in that when you stop using it, you're probably going to go back to your baseline of low hormones and will regress back to your how you felt before. So if you're looking for this as a transition through menopause, absolutely, but then when you stop the program, you are going to you will not feel as good anymore. And so it really, and I think that doing the first trial of it, even giving us a year to really get it down, and then you decide, is this something worth your investment into yourself? And really, this was just an introduction, but there really is the prevention of a lot of chronic diseases. You're going to have less onset of hypertension, less obesity-related conditions. So is this an investment to age better and feel better? But it could be lifelong. It could be a relationship with me that would be ongoing for a while, or after a year, you could say, you know what, it just wasn't for me, or my budget couldn't take it. But I feel so. I believe in it that I think your quality of life is so much better, and so you want to age better.
Perfect. Thank you. Next question. If you have a family ATM gene mutation, can we still use this treatment?
I think I'd have to probably look into that and just make sure specifically for that condition that we have the information, since that is pretty unique to that individual. Definitely something that if you wouldn't mind emailing me, and then we can talk about that together on an individualized basis.
I think that's great. And it actually brings up the point, what you mentioned earlier, is this is customized per each individual. So between the labs and the medical history and the dosing side, it is very individualized. So that makes sense. Yes. So if you have specific questions that are related to your needs, then I think Dr. Esteva would work with you individually on those. Next one, is this treatment covered in any way by health insurance, PPO?
So PPO, so we could probably, we could put some coding so that your labs could be covered. Some of the thyroid supplementation might be covered. And if you wanted to try, we could put it in under your insurance. And then if you get a bill, then we can convert it to basically our discounted rate for laboratories. Currently, we do not accept insurance, and a lot of insurances are not reimbursing completely for the entire hormone replacement. So again, it would be individualized. Typically, our labs are cheaper than your copays because we do have specialized pricing with LabCorp through BioTE. But we're more than happy to try and get it to go through your insurance. But the inserts are going to be all cash. One of the things that you can use, though, and not everyone has this, but people are able to use their health spending account, which is called an FSA, or your health, your FSA or your HSA are able to be used. I just write you a letter and you can utilize those funds. Only a small amount. I think you can max out at $2,500 a year, and 500 rolls over every year. So that would be well within that range.
Perfect. Thank you. Next question. Where is the pellet inserted?
Oh, that's a good question. I'm sorry. It's inserted in your buttocks, about 3 centimeters or about 3 finger breadths from the top of I don't know, the cleft or your crack. Anyone who knows me laughing right now. Okay. Just on the side of your fingers, and I switch sides every session. And so we'll start on the right, and then we'll go to the left, and we'll kind of move on from there.
So upper hip area is also
upper hip. Yeah.
Okay. Can women in their 70s start this treatment?
Yes, they can. We would obviously just go through your health history.
Perfect. Great. And how do you know if this treatment is good for you? For me, someone asked, how would I know if this is a good treatment for me, and is it safe?
I think that's a really good question. We have a wellness questionnaire that basically highlighted a lot of the symptoms, and it's just like anything that I tell women or men in general. It just depends on how it affects them individually. You might be someone who's very happy where you're at, and your mood and how you feel, and don't feel it's worth that. But if it's affecting your daily life, and you go through the symptom checklist, and they're in the moderate to severe range, how much you're feeling it, then I think it'd be worth a try, or at least a consultation to see, risk benefit ratio, what you think it could do for you. If you feel like you're 9 out of 10 daily living and you're fine, well, and you really don't buy too much into the health prevention, because you say, well, I feel good, everything's fine, well, then maybe it's not for you. However, I do think that there are benefits that you will get long-term health-wise. And so just come and chat with me. I'm really informal in being able to kind of see what's the best options for you.
Perfect. Can you discuss or describe the procedure itself? Does it hurt?
Yes. No. Yes, I can describe the procedure. So basically, we use a little bit of lidocaine to numb the area. That's the only thing you're gonna feel. So any of my clients who have any of my other aesthetic procedures like Botox, it's just one little poke versus multiple pokes. So it's comparable to that, just a little sting. After that, you really don't feel a whole lot. You feel pressure in the site when we place it, but I use a small little what's called cannula, or a little a skinnier tube, like to go ahead and insert these rice-sized pellets right under the skin after I numb it. In men, because they need more testosterone, I do it in 3 different areas, and so it's kind of like in a V type shape. So I put a row here, a row here, and a row here. So I numb a larger area, but still pretty well tolerated. After I numb it, we close it off with a little Band-Aid or something called the stereo strip, where we kind of glue it. And the biggest thing is just the aftercare. You cannot have vigorous exercise or activity. You can't go hiking 5 miles after you have it placed for 5 to 7 days, and it's really important because we don't want anything to any of the pellets to come back out. But after that period, for 4 to 6 months, you're golden and can do all the physical activity, and you're going to want to do. It's going to give you that boost and energy. So it'll be well worth it to take that week off And it's not that you're bedbound by any means. It's just we don't want anything vigorous.
How long does the procedure take itself? And are there any side effects to the procedure?
So the procedure for women, 5 to 10 minutes, for men, 10 to 15 minutes. The side effects, like any time you have any type of procedure, anytime you insert anything into skin, you're cutting the skin, infection, bleeding, pain are the big soreness at the site. Very rarely you can get what's called a bruise or a hematoma, so blood surrounds the pellets. It's pretty rare. But not zero. You can also get where the pellets come back out, but that's pretty rare. It's less than 1 to 2% of the time.
Perfect. So the last two questions that I see, oh no, another one just came up. 1 second here. How long does it take to get the labs? How fast can we get the implants?
I believe the labs take about 3 days, 3 to 4 days to go through. So if you are interested, we would have you just call the spa. We can email you the lab slip. You can go to your closest lab core, and I should have it within 3 to 4 days, and we can get you in next week to start pelleting you, if it's a good fit.
Perfect.
Yeah. The other way you could do it, if you're not sure, you don't want to invest in the labs, you can come talk to me. We can do your questionnaire, your intake, see how you're feeling. Then at that point, you can get the labs. Just realize you will not be treated that same day. But everyone has their own process of how they want to do this, and both is okay. If like this was enough, great, get your labs done. If you want to talk to me first, then we'll order your labs. Then you'll probably get done the next week.
So how can you tell us again how one would schedule an appointment? Do they call the office, or how do they schedule an appointment or schedule to get their labs?
Absolutely. So we just call the office. We will send you, if you decide to go ahead and do your labs first, we'll email you the lab slip, and they'll schedule you shortly after for a consultation with me within the next 7 days.
Perfect. And then the last two questions that I have are related to cost. So one asked the cost for the labs, and the consult, and the implants, so the treatment, and then another one was asking the cost of the treatment.
So in general, and this is a pretty standardized price, I think that we're not going to be much different from anyone else in the area. There are BioTE providers, but what you're going to find here is a really customized, hands-on approach, as well as one-on-one with me. I do this a lot like my weight management program, where you have access to me pretty much 24/7. So typical pricing is around $400 for females for the pellet insertion, not including the labs, and $800 for men. But men, remember, can go 5 to 6 months. Okay, so they need it twice or 3 times a year, but that's stretching. It'll overlap into the next year. And women will be, every 4 to 5 months. So it ends up being about the same. And it's because men need a lot more testosterone inserted. The initial labs, I believe, are around $130 to $45. And then we have intervals where I get a second set of labs just to make sure that you're coming up to the levels that you need. And those are a little less than 100.
Perfect.
But just just in all fairness, I just want to say there are some of those mandatory supplements that you would need to invest in. They're not outrageous. Melissa, a bottle of DIM, how much would that be? It's about, for 90 pills, I think it's in the 30s, and it would last you a couple months. So there is some pharmaceuticals that are going to be mandatory. Also, if you're postmenopausal, in order to protect your uterus, if you have a uterus, I will have to prescribe some progesterone, and we'll talk more into that. That's something also that potentially your insurance would pay for. But also, I think it's for 100 of them, we're looking at around $80.
And we do have what we call the core of the nutraceutical line that we recommend, that they offer here at Silhouette. And I would say for the core 4, to when you get your insertion, if Dr. Esteva does recommend the core 4, it would probably be about $100 for the whole set.
Right. So what does that provide? It's basically preventing some of the side effects of the testosterone being converted to estrogen. It also addresses, and this is a big thing that I didn't even have a chance to mention, some of the immunity benefits that you get by not only optimizing your hormones, which improve and optimizing your thyroid gland, which is another supplement that I would actually recommend. But it also, with these nutraceuticals, you get vitamin D, ADK, with vitamin A, D, and K. But when you have vitamin D levels above 80, you're going to be corona protective, which is really, and it's really going to optimize. Vitamin D is actually considered a hormone, so that's something I would recommend. In addition to some iodine, and we'll talk about these supplements. I don't want people to get pill fatigue, but I do recommend that we start you out with something really basic like Core 4 that is doable, that will make you feel a whole lot better. And I'll tell you what you need to do and what we can consider.
Perfect. And that is all the questions that we have. We can give it another second or two to see if any more come in. And Dr. Esteva, did you have anything else you wanted to add?
No, I'm excited. I think that you're going to feel a whole lot better, a whole lot like yourself, especially if you're just overall your general fatigue, brain fogginess. It really is a life-changing treatment that I'm excited because it's just something that's not addressed in your normal office visit. I think the other thing that will be important is just gaining that trust with me, and also letting you know that I'm very comfortable talking to your primary care physicians. And just as I tell other clients about weight loss, about our primary docs, sometimes when you don't know something, it's automatically bad, but I feel comfortable in being able to talk and educate people and let them know what our goal is and what the point of our treatment is, and obviously very collegial, evidence-based way.
Excellent. Thank you so much, Dr. Esteva.
I think
it's been very informational, and thank you everyone for attending.
I look forward to seeing y'all.